Troubleshooting and alarms. Check lines. The 6 check line alarms are: check drain line, check patient line, check final line, check supply line, check heater line, check lines and bags. Your patient cycler may display any of these messages. However, you or your patient will follow the same troubleshooting and alarm correction techniques. All of the check lines alarms are auto restart alarms, except check lines and bags. The most commonly identified causes for a check lines alarm include: cause number 1. The line referenced on the display screen is blocked due to kinks, closed clamps, fibrin blockage, blocked solution bag port, also called port choke-off, empty solution bags. If cause number 1 occurs, correct the issue found. If possible, open clamps or clear kinks. Ensure adequate flow by checking the connection. This includes twisting the spike or wiggling the frangible, undoing the kink if one is present, and repositioning the bags by flipping them over or folding them in half. If fibrin is detected, the patient should contact the clinic so you can follow your clinic's protocol. If solution bags are empty, you may want to follow the procedure identified next. If the alarm is related to empty solution bags and the patient reports multiple occurrences, evaluate the patient's APD prescription and the volume of solution used for the treatment. Since the system keeps an estimate of the amount of fluid in the patient's peritoneal cavity at any given time in the therapy, improper programming of these settings may have adverse effects leading to excess volume filled or insufficient volume drained from the patient. Remember these values. During priming and setup, 250 milliliters of solution is needed to prime the heater bag and to complete the integrity test. 120 milliliters of solution is the priming volume for each additional supply line. 45 milliliters is required to prime the patient line. A standard recommendation is for an additional 500 milliliters to be added to the patient's APD prescription when using 2 solution bags. In this example case, 250 milliliters would be needed to prime the heater bag and complete the integrity test, plus 45 milliliters to prime the patient line, plus 120 milliliters to prime the supply line, equaling 415 milliliters. When using 3 solution bags, the additional priming solution required is more. In this case, 250 milliliters to prime the heater bag and complete the integrity test, plus 45 milliliters to prime the patient line, plus 120 milliliters to prime each of the supply lines. This would equal 535 milliliters of solution. Make sure enough solution is being provided to your patients to complete the priming and setup activities without causing the patient to run out of solution before their treatment is complete. Cause number 2. If the check patient line appears at the start of fill 1 in standard mode, then the cause is the clamp on the patient line may not have been opened after connecting the solution bags or after the patient was connected, thus preventing priming of the patient line. If this alarm occurs, do not open the clamp due to a risk of air infusion and IIPV. If cause number 2 occurs, press stop. Press the down arrow until manual drain appears, if it is not already displayed. Press enter to initiate manual drain. Then open the clamp on the patient line. Press go after manual drain is finished. Cause number 3. If the check heater line appears at the start of fill 1 only, there is an occluded heater or drain line. If cause number 3 occurs, check the heater line, check the drain line. Undo any kinks or tubing obstructions found. Even though check heater line appears on the screen, it is possible for the cause to be a blocked drain line. Cause number 4. Check lines and bags appears if one or more of the lines in the disposable set or solution bags are blocked or solution bags are empty. As a reminder, this is a manual restart alarm. If cause number 4 occurs, press stop to mute the alarm. Check all lines and bags for kinks, closed clamps, fibrin blockage, blocked solution bag port, disconnected solution bags, or empty solution bags. If the alarm repeats, follow the advice presented for cause number 1 regarding making sure additional solution is available for priming all necessary lines. Correct the issue found. Open clamps or clear kinks. Ensure adequate flow by checking the connection. This includes twisting the spike or wiggling the frangible, undoing the kink if one is present, and repositioning the bags by flipping them over or folding them in half. If fibrin is detected, the patient should contact the clinic so you can follow your clinic's protocol. If solution bags are empty, you may want to follow the procedure identified previously. When the issue has been resolved, press go and the patient will return to their therapy. Patients should contact the dialysis center if they encounter a check lines and bags alarm. The nurse should review the amount of solution prescribed for the therapy, total volume, comparing this amount with the amount of solution used for therapy and priming volume required to see if this is the cause for patients experiencing the check lines and bags alarm. Baxter advises you to use the following alarm prevention techniques. Tip number 1. To avoid this alarm, make sure the APD prescription allows for approximately 500 milliliters of additional solution to prime the lines. For example, if 12 liters of solution is connected to the device, 11.5 liters should be used for treatment, allowing 500 milliliters for system priming and troubleshooting. Tip number 2. Teach the patient how to place the bags appropriately on the heater pan. Refer to the Patient at Home Guide for additional information. Place one bag on the heater pan. Place the edge of the bag against the right side of the heater pan. Make sure that the bag completely covers the heater sensor button. Tip number 3. Do not stack supply bags. Place them on a flat surface.